On this week's episode, we have Nurse Whitney here in the studio, and we're going to talk the Kim K Vampire Facial. And I can't wait.
PRF, which is similar to PRP.
Yes.
And in our celebrity talk, don't miss who has the sexiest lips in Hollywood.
You don't mess up Angelina's lips.
No. Make sure you stay tuned because
We're doing this. Hey everyone, welcome to this week's episode of the Champagne Hour, Bubbly and Beauty Secrets, sponsored by the Skin Research Institute. I am the most fabulous host, BP, but my co-host is the gorgeous, wealthy, the fabulous Payez, and we have a special guest, Nurse Whitney.
And Nurse Whitney, thank you so much for being with us today.
Thanks for having me.
A med spa called Pure Glow Wellness, correct?
Aesthetics and wellness, yes.
And it is in Murrieta.
So I'm in
thank you
Temecula. So I always tell people, if you're out there drinking wine, stop by, see me.
Before or after?
Both.
All right.
And so then we're talking about today PRF, which is similar to PRP.
Yes.
Facials. And we're talking about lip fillers and IV hydration.
Hydration, yes.
Yeah, let's start with the PRF.
All right. Well, PRF, that's actually the newer thing. It's pretty awesome. Everyone knows PRP. They know the Kim Kardashian vampire facial. That's what we use. We draw your blood, we spin that out, and we take your plasma and we place it onto your face, calling it that's why it's called the vampire facial. We're using your blood. It's really good with regenerative properties. It has stem cells in it. And the big difference between PRF and PRP is that we have now understood that we don't need to take everything out of your blood and just use the plasma. We want to keep some of the fibrin in there to create building blocks to help that elastin and collagen build up in your skin. And we need elastin and collagen in our skin.
Yeah, we do. That's why everybody's putting it in their water,
In the
right?
water, yes.
Oh, yeah.
I don't know. I don't like stuff that I have to drink, though.
That's the
I
only
prefer
way,
drinking
right?
it. It's so much
I don't
easier.
know. I bought stuff. I sent it back. I'm like, this is not for me.
But the creams with collagen, they don't work, and the pills don't work, right?
Well, they work to an extent. You know, people are trying to drink it because they're like, oh, if I put it in my body, then my body's going to use it. Well, all of a lot of our organs have elastin and collagen in them too, so they're going to take it. You're not going to see it really on your face. So doing things like this kind of helps keep it onto your face because your body only takes things in when you digest it, about like 40% of it for what you
Absorb
from what it
right.
states on the
Okay.
labels. Yeah. So when people are like, oh, I'm just going to like overdose on some collagen, it's like, well, good luck. You're going to probably shit it out.
I'm feeling like, so I look at my daughter, she's about a year old, and I look at her and all this collagen, and I feel like Sleeping Beauty or whatever, and I just...
Hannibal Lecter.
So like with my daughter, yes, I'm like, now I understand where, Sleeping Beauty and like all these Disney movies with these villains, the Snow White.
Botox wasn't
yes, they're
invented
like,
yet.
let me siphon it from you.
Yeah.
Let's siphon it from
Especially
you.
because I feel like with my first kid, I still looked, I was like, oh, I was young. I was like, that's good. With her, I feel like she sucked the beauty out of me.
I think girls do that.
Girls do
No,
that.
because I only have a girl, and when I had her, I was just like, I feel ugly now.
Ugly, like the skin.
You're beautiful, but I'm ugly now. What happened?
It took everything out
You're
of
like,
me.
mirror, mirror on the wall.
Yeah. Girls
Now I
do
understand
that.
the whole evil stepmother kind of thing. Like I said, I don't think it was the evil stepmom. I think it was the mom that was like, hold on.
Well, but going back to the PRF, so this is interesting because when I was talking to you about it, you actually do it in
Office.
Yes,
all the
blood,
stuff is done. Yeah. So, I mean, obviously I'm a nurse, so I understand how to handle blood and blood products and things like that. And it's actually pretty easy. And it's funny because in the hospital, nurses don't really draw blood that much. It's typically like a phlebotomist doing it. But, we access the vein just as you would if you were going to give blood.
And just out of the
And
arm.
it's just a little tube that we put it in. We drop it into a little centrifuge and spin it out and pop it right back out. And all you have to do, the way to separate our blood is literally through centrifuging it. It's by that spinning it out. The red blood cells will attach to each other and the plasma will separate because the plasma is like full of like water pretty much. But that's what holds all of our like extracellular matrix stuff that's good for us in our body.
So the plasma is the stuff that you take and put back into the skin?
What do you do with the blood?
Just toss it. You don't need it at that point. And it's very little. So it's
Okay.
not like enough to where you're going to pass out if I took all this blood out. It's a tiny amount.
Like, can you put it back?
Well, and then I'm sure people have questions about how sanitary any of that stuff is,
Absolutely.
right?
I have gloves on when I'm doing this.
But, I mean, you know, like,
It's
blood
an
and there's
aseptic.
disease
Yes,
and there's
yes.
virus
You're
and-
going to have the area cleaned with either alcohol or some sort of other antiseptic that's in that area. We use Purison as well. I could talk about Purison on its own. It's hyperchloric acid. It's actually salt water, and when you ionize it. And so it's a really good antimicrobial agent. Either that or there's Hebaclans. There's all sorts of stuff. But you have the area cleaned up, just like if you were getting your blood drawn. Put tourniquet on, clean you up, pop the little needle in, have the blood drawn out, and like I said, a tube, and then you're good to go. And just a little Band-Aid just goes on over it.
Who even figured something like that out? Like, hey, let's just put blood on
Yeah.
our face.
It's just, it's honestly demand. It's
Well, that's a good question because,
did
like,
figure it out?
is it just to make money or does it really work?
It really does work. You will find tons of studies that are on it. And it's not just one person, I should say, that was like the center of it. This has been like researched and studied for years. And we're starting to see everyone wants to look younger. Everyone wants to have that youthful appearance. And so we're starting to see that things that we've done in other areas of medicine can be applied to beauty. So they are actually using PRP to regenerate joints and everything. So orthopedics
I have
were
heard
using
that.
it. They would place it. They would do the same thing. They're drawing out your blood, and then they just inject it into the joint area of your in a joint, your elbow, your wrist. People that are having carpal tunnel, especially nowadays, we're always on our computers and stuff. So,
The point of it being, I was thinking vampire facial meant like you were sticking the blood on my face, but you're drawing the blood.
I know.
and
I
then
feel like the Kim Kardashian one was very overdone. You
Just
don't
for
get that
clickbaity.
bloody. Yeah, you don't get that bloody at all.
Okay.
You don't walk out of here like, oh my gosh, like I have blood all over my face.
Because you're not like doing anything. Are you doing anything to the skin before the the plasma goes on?
No, you're just numbing it, and the plasma just acts pretty much like as a slip agent on the skin for the microneedling. To
Oh, and then
work
you
through.
microneedle.
And you microneedle it in. That's
So
the
they
vamp.
use the little-
Yes, that's
Got
why
it.
it's a vampire facial. So, and I know that was misleading because like Kim K just has like blood all over
Yeah,
her
she
face.
was like a
That
murderer.
got microneedled in. So there's like a microneedling device that goes with that, and it creates little micro channels, creating little micro injuries in the skin. And all of this is just to regenerate the skin. So it's not just like you're, rubbing it on your skin. It's not going to work that way.
Right.
That way, you're going to be like, this stuff didn't work. I don't even know why I
Yeah.
did that. That was disgusting.
I have a question though. I saw when I was doing research, I saw people actually getting the blood
Injection?
injected into the skin.
That's
so
a
how's
whole-
that different?
So that the difference with that is we're just placing it and pinpointing where we want it to go. So actually we do that under eyes. I like doing that a lot under the eye area. It's called the tear trough area because
Okay.
we end up looking tired over time. Like we end
So
up getting
wait,
dark
is it like
circles.
to replace filler?
So when
or-
you start seeing this like dark circle in this area, you start seeing lines that are coming from this area of your face, or it looks like you kind of have a bag. That's because you're losing volume loss. That fat pad that's right here is kind of dropping down.
Do I have that?
You have a little volume loss, but we all do at this point in
So
time.
would that help me?
Yes, yeah.
Because I want to do something here, but I don't want to do filler, and I don't know what else to do.
I always go on the side of caution. You don't want to place filler here because the skin is very thin. It's really thin and fragile. Filler is clear. And a lot of times we can place filler there, but that's kind of like the last resort. Let's do stuff to rebuild it and regenerate
That's
the
smart.
area.
I like that.
And then you're gonna glaze it over with some filler.
Because I've been told the opposite, like, oh, you need filler. You need filler.
Oh,
You need
absolutely.
filler.
Yeah. Because, and that just goes to, I always love, that's why I always tell people nurses do actually do this a whole lot more than some physicians. Because they're like, no, my doctor told me to just put filler under here.
Yeah.
I'm like, your doctor doesn't do this all the time. So I'm going to tell you what you're going to look like. It'll look good the day that you do it. You'll look good for a couple months, and then all of a sudden you're going to start seeing blue, or your eye's going to look a little black right here because you're starting to see that filler push up. There's a muscle here, so you have to be aware of that. Anatomy is like the biggest thing, and understanding that is.
And don't you find that fascinating, though, like with the different guests that we have, that we're getting different perspectives
You will.
on the
Yes.
same area?
Yeah.
And ultimately achieving the same result.
And that is dependent on the provider and what they like to do.
Yeah.
And that's the biggest thing.
But this to me is fascinating because I would,
'Cause it's
this
natural.
I would
It seems
do
natural.
it. It's
Seems
like
natural.
just my
It's your
body
own
going
blood.
back into my own body.
It is. It's very natural. And that's why I like doing it. That's why I like going towards that right now too, because you'll see things. There was actually a provider who's very well known. He's an influencer. And he had filler placed here and had this like really bad reaction. We still all don't know like the whole gist of it. It was with a particular filler company that everybody knows with. And it's like, we're like, okay, well, does this filler not go here? Or like what's going on? Is there stuff that we probably should be looking more into? And just for me, I'm like, it would be better. That just makes sense for me to replace something in my body with something that was already in there.
Yeah.
Not a foreign
Instead
substance.
of going in with something
Yeah.
that is foreign right now to make my body get used to it. So we kind of going with that, you're regenerating those cells. Because as we age, actually at the age of 25, you start losing collagen. You lose about 1% every year that as you
crap.
age.
Oh,
At
so
my
you're not
age, I've
producing-
already lost 75%.
Yes, that's where everyone got the option. They're like, let's just do supplements and stuff, then we can replace it. It's like, well, it's not the same because your body's literally not producing it anymore.
Yeah.
So as much as you were, that's why kids look so amazing.
So if I was to do something like that, which we're doing this. I mean, maybe not today, but we're doing it. I really want to do that because I do feel like I'm tired.
I was like, well,
You know.
honestly, we could probably do that. That would probably be something we could do.
Right now.
Yeah.
I'm game.
Excited.
Are you gonna me up, or am I gonna look alright?
You will look good. You will look good. I
Are you gonna
promise.
bruise me?
It might bruise. So that's
Hang
another.
on, what have I got on? Let
We
me
might
think.
have to worry
What do you
about.
mean, makeup wise?
No work.
Oh.
No, I'm fine.
Can you have? Can you have by the worst case scenario? Because you could possibly get a little bit of a black eye. That's rare to happen.
That's
but
hot.
It's,
Like you got
Sexy.
Like tell
good.
somebody you beat somebody up in a bar.
Yes.
Gosh,
Yeah.
well,
look,
this took
see,
a
that's
turn.
that was your Friday night. That was your Friday
That was
night.
my Friday night.
I will totally let you do that to me. But
'cause-
but I want to know the truth, right? If I do this right now, and if you worst case scenario, you F my eye up and I get a black eye, how long am I gonna look?
At the most, like about 2 weeks.
Oh Lord Jesus!
and you
I got
might
a
be-
wedding.
You have
concealer, you can use, you know.
yes. After today, you'll be able to place concealer on it. I just tell you today, you wouldn't be able to put anything onto your face, just because you want to keep that area clean. You don't want there's needle pokes. You have technically an open wound right there, so you don't
Yes.
want to place anything on there. But for the most part, you'll be a little swollen tomorrow, if anything. But other than that, you just look refreshed after.
Oh.
I've never
You should
really.
have led with that.
I always lead with the worst because
No,
you know
it's
what?
good.
If
I like
it
the
lasts that
transparency.
2 weeks, I would rather you be prepared for that 2 weeks than you just go, oh my gosh, I'm going to look gorgeous today.
And then look in the mirror like, what the
And you're
hell?
like, what the hell? Because that
how long
actually
does
what
that,
leads
how long
to.
is that gonna last then?
So that last, that one you need to do a series of. You need to do one at least once a month.
So it's like a
for
building?
for 3 months. Yes, to just allow it to build up. And
Okay.
then after that, we look at it and we go, okay, look, you do need some filler. You need a little bit more support in that area.
And what would something like that cost if you have to go
If
3
it-
months,
if-
like a whole treatment?
For a whole treat, if you're doing all 3 treatments, they could do package deals. Typically, one treatment is about $650, and then it goes up from there depending on if you want to do the packaging it together or pay $650 every time that you come in.
Got it.
So,
And how many needles? Like, so one needle here to draw the blood out.
Yeah.
And then what the hell's going on up here?
and then it's little insulin needles that I use in this area.
There's a what?
Little insulin needles.
Like a
Yeah.
Botox needle?
Yes,
Okay.
yes. So you're just getting that around. So if you've had Botox around this area of the eye, it kind
Yeah,
of feels
I have.
similar. It doesn't hurt too much.
Yeah. And I don't need lidocaine or anything like that?
No,
Or
no,
Namicare?
not in this area. It's really just like I said, the little needle pokes. If you put lidocaine, it's just really for comfort, just when you're like inserting it in this area.
And I would only really bruise if you are really bad, because those needles are tiny.
They
And you
are
could-
tiny. So the reason why I say you could bruise is because sometimes I do like to go in with a cannula to like lay a little bit more in.
What does that mean?
A cannula is a needle that's like a long straw.
Oh God.
It's actually causes less tissue damage, and it's preferred in this area because of the structures that are there. So think about it. As we're talking about this, just think about it, because you probably don't want to like jump right on in.
no,
My area's a
we
little
are
scary.
doing it. We are doing it.
Because
How
some
much
people
is this
just
consultation right now?
And you're going to watch.
Some people just get a little nervous because you're by their eyes and they're just like, what's going on? So
Yeah.
talk about all of these things just so that you're prepared.
Okay.
I used to be like that when I first started getting my lashes done. You know, when you're laying there
Oh,
and they
yeah.
tape your eyes shut, I had anxiety. I was like, oh my
Yeah.
God, I can't do this.
And then all you feel is this little sharp thing, and you're like, what are you
Yeah,
doing? Are you
yeah.
are you touching? Like,
Yeah, it was weird. I got used to it.
Man. Well,
a
yeah,
little scary.
this took a turn, like I said. But yeah, we'll do that at the end? We'll do that at the
How
end.
long does it take?
It doesn't take that long at all.
Okay, we'll do that at the end. But we'll,
I'm excited for you.
Like 15 minutes, if that.
I'm a little jealous, actually.
Do you want it? I can do it.
No.
I'll show you.
Not a trained
I'm a
professional.
very good
so
trainer,
easy.
actually. So I can show you that.
Yes, I'll just spin the blood and stuff.
Oh,
Teamwork.
man. Oh, but we do also want to talk about some lip fillers.
Oh, yes.
Right?
Lip filler is
Speaking of
always the hot
fillers.
topic.
Yeah. So when we talked, you said lip fillers was the second most asked about procedure.
Other than Botox,
Other
yeah.
than Botox. So why
Yep.
is that?
That's just the first thing that people see, because I mean, you see all these celebrities and it's like, well, why do their lips look like that? Well, they had lip filler, and now everyone's talking about it more too. Before, I would say even 5-6 years before, people weren't really talking about their lips. Now everybody's talking about their lips.
Talking in the sense where they
that
were
they're
hiding
getting
it.
lip filler. Yes, they
Now
weren't-
they
they
talk
weren't
right.
about
telling
it. Kind of
you
like cocaine.
why-
People talk about cocaine now.
Yeah, exactly.
They do.
They
God.
do.
Where are you
They do.
socializing?
They're-
People always like,
Cocaine is not taboo anymore.
Yeah, people
it's
just talk about
not.
it
They're
now.
just like, no, you don't do it. And no.
They're like,
you
here.
do it. You
Lord.
get in you get in professional situations, and you're just like, hold on, that's how you stay up. Okay, I see why you wrote all those papers now.
It's all making sense.
I see why your scholarly reviews are coming from, because all that stuff does take time. It's hard.
Yeah.
So yes. Oh, so going back to that.
Lips.
So lips.
Lips. Yes.
So when I think about that, all I think is ouch, 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 ouch.
It is.
ouch.
So that's the one thing that, kind of sucks for my job, because people will come in and they go, okay, I want Botox. You know what? The next thing, I think I want my lips done. My friend was telling me I want to get my lips done. And you're like, oh, that hurts. Like, that's one of the areas that actually hurts the most. You could get Botox actually placed up on your upper lip too. So what I tell people is, like, if you've ever had a pimple on your lip and you've popped it, think of that kind of over and over again, because that's what the needle feels like going in.
And the filler has lidocaine,
Has lidocaine in it. Yes. So there's
but
ways
you're still getting
you
pain?
still get a little pain from it.
I
So
see that.
the best way that what we do now is we call it a dental block, because
Well,
we've
yeah,
learned
okay.
it from the dentist. Hey, you can numb the mouth and you won't be able to feel your lips. And anyone that's had dental work done, they're like, oh yeah, because they'll talk about like getting their lip pierced or something at that point in time, because they're like, I can't feel it.
Yeah.
Well, you can get lip filler at that time too, because you can't feel it.
I think I would want.
So
a
is it
dental
like going
block.
into that same nerve that the dentist?
Yes, yeah.
does?
You have a nerve that goes
Like right
in right
there,
here. You
I
actually
just got
have
a
a nerve
crown,
that
so.
comes from here, and it goes down and it feeds this top lip. And if you numb these areas, you won't feel it, and you won't feel anything in your lip. So it's actually really nice.
Well,
Jeez.
I don't know. I don't
I've
care.
always been scared of getting my lips done because, firstly, I have gorgeous lips, and
You
Yeah,
actually
me
do. So
thank you. My grandmother always said that I got my lips from her. I also got her attitude. She was a feisty old thing. But I'm getting older, and I can see that my lips aren't as
volume.
full. But I am scared to get filler because I don't want to look fake. I'm not worried if someone said, "Did you get filler?" I'm not going to lie about it.
yeah,
But I'm scared
you don't want
I'm
it to
gonna
look
look-
unnatural.
Yeah.
Absolutely. Yeah, that's where the technique, and you do want to kind of be picky about your provider at that point in time. Ask for their work beforehand. They may not have it on social media, but they should have something in office to show you.
Right.
That like, hey, these are the clients that I've done, and this is what they've looked like before. And that also goes to the provider's we're all individuals still here. You know, what I think is beautiful may not be the next provider that thinks is beautiful. And this is actually a hot topic in my field right now, because some people, for instance, they would tell me, you don't need lip filler. And I'm like, well, I've already had lip filler. And then they're like, oh, but I'm like, but it didn't change the way my lip look. It added the volume back to it.
Right.
So when I tell people, because they'll come to me
If
too.
you explained it to me in that way, I would go, oh yeah, that doesn't scare me.
It doesn't.
If you're just replacing my volume.
We're just replacing the volume. We're just hydrating. We're rehydrating
But does that mean
lip.
you're going like,
I'm still scared.
where are you going?
So we're going into the lip structures, and now you're talking about techniques. So there's
Right.
different types of techniques. There's one that's called a tenting technique, where we're like creating little fence posts and going up
Is
this
that for
way.
like a lip dip like he has right here? Or
So that's to kind of help elevate. Like, he has good lips, so you would just like the technique. I would just follow his lip structure. I wouldn't want to
Where
change his
around-
lip structure.
around like
I would
that?
just go around your lip. So we would be going in, fanning
Okay.
into your lip,
Oh,
fanning into this area.
In my mind, they just go like, stick it in and they're like, pull it out.
So that was like the old wave where we were seeing people do it.
was a thing.
Where they were like going in and just placing like boluses and
Yeah,
then going
yeah.
and massaging
I'll pass
it
out.
out. You can do that, but I mean, it's an art form.
So
we're
you're
talking
saying
about art here.
You
so.
go in and you fan it? What does that mean?
Yeah. So if when you're going in with the needle, for instance, like this is the lip structure, you're gonna go in and fan it around.
just a little around.
Yeah.
Just like boom, boom.
Yes.
boom,
So if I was
boom.
seeing your lip right here, so I would actually use a tenting
you-
technique
do you
on
want
your
a
lip.
piece
I'm
of-
sorry. Over here, thank you. So I, looking at your lip, we would place and push this up here, and we would want to do those little fence posts to kind of help avert this lip up. We want more of the pink of your lip where you put your lipstick on to show.
Your lipstick.
Your
love
lip,
it.
you already have the pink showing, so we want to just keep
I
it
don't
there and
have an upper
rehydrate
lip.
it.
Oh, I love her.
So when I'm,
I love Nurse Whitney.
oh, let me draw like an actual lip correctly here. Kind of. I'm not an artist when it comes to this
I like
sense,
that.
okay?
It's a good lip.
Can you see that?
So,
there we go.
when-
Look at
is
that
this up?
gorgeous
There we go.
All right.
So when I'm talking about fanning, you're just literally creating a fan. So these are where like the needles are going. So I can fan out this way too. And then so you see how it's creating this
yeah.
like
And it gives you
structure.
volume, I would imagine.
It's giving you volume and you're creating structure. Now what I was talking about with the fencing, you're going into the lip. Let me just draw. So you're going down into the lip this way, and you can create more little structures this way as well. Going down into the lip, kind of like I said, trying to avert that lip up. Now, understanding lip anatomy is very important for this because when certain people can't have certain techniques and
Right.
it takes time. So when people are thinking, oh, I don't want my lips to look huge and ginormous, well, that takes time. We're going to be talking about multiple sessions, multiple
Right.
syringes of filler. I always tell people, because Kylie Jenner was with her lips, she still is kind of a big topic with lip filler. But she's the one that people would bring in and be like, I want Kylie lips. And I'm like, well, Kylie has like probably 5 syringes in her lips,
Right.
because let's look at where she started from and what her lips look like right now. And I mean, there could have been probably fat transfers surgically that she had done too.
That lasts forever.
Nothing lasts forever.
Nothing
I
lasts.
say.
Yeah.
We love to say things last forever.
strong word.
That's
Yeah,
a strong word, but it lasts a long
longer.
time. It
Okay.
does last a long time, and that takes maintenance actually too.
Yeah.
I always tell, people have probably seen this like meme going around too. It's like you're not ugly, you're just poor. And it's the worst. It's the worst thing to say to someone, but it's the truth.
It's
It's like
true.
you're really
Don't say
not
that to people.
ugly.
Yeah.
It's just
you're
this
poor.
stuff. It costs a lot to
costs
maintain
a lot.
because nothing lasts forever, and so our body will constantly regenerate itself, and so it's going to take away some of that. Like how we have lost volume now. The reason why you're going in to get lip filler, you're going to lose that volume again from that filler.
Of course,
and we have
yeah.
to replace it again. The biggest difference is that now we're looking at, okay, well, we're gonna get more longevity out of it because we're placing a substance in to replace what our body can't do anymore.
Would either of you, would you do,
Lip filler.
are you interested, like in your life, of getting fillers or lip fillers? Or
I've never.
how do you feel about it?
No, I do want to get like all kinds of stuff when I can
Yeah.
afford it.
So let's say you had access to whatever you wanted. What would you want? Would you want?
Yeah, if you
filler?
had an unlimited amount.
I don't know enough all I know is what, Dr. Lee told us last week is that I didn't realize filler is for the after wrinkle, the wrinkle that's already there.
Yes.
Which I didn't realize.
Yes.
So yeah, I guess I would do all kinds of stuff. I wouldn't do lip filler because I don't know. It seems ouchy to me.
It does hurt, but I will say lips are the one that's kind of like the gateway. Yeah. That's the gateway filler.
Pain is beauty.
That's what the filler that gets you into doing filler. Because typically when you'll see people have filler placed everywhere else, it's not as dramatic. At least you don't want it to look dramatic. You don't want it to look overdone. And so it's not a big wow factor for people to go, okay, I feel like I do need to keep doing that. Like your lips, when you get your lips done, you're like, okay, no, I need to get my lips done again.
Can't I just walk around like...
You could actually. That's actually the lip filler patient. They'll walk around and go, "Oh, it's like, okay, can you please roll your lip back in?"
Relax.
You don't look like that, and please don't let people think you look like that because I don't want that to my name.
Yeah. Speaking of Kim K, we found a video that we thought might be helpful right now. Let's take a look.
Kim Kardashian West is out for blood and suing an Alabama doctor for using her name, image, and likeness to promote vampire facials.
Oh, yeah, that's
Kim famously made headlines years ago when she underwent the cosmetic procedure seen here on her Instagram, which involves injecting your own blood back into your face while filming her reality show Kourtney and Kim Take Miami. The star admitted just last year that she regretted the treatment, and now she's suing Dr. Charles Runnels for using her name and image to sell the service without her permission. In the complaint filed in California federal court on Monday, she alleges Runnels has been using her name, face, and even an Instagram pic to boost his licensing business.
Yeah. So that's interesting just because everyone thinks that she
that's funny. I actually have never heard that she did not like that.
See?
That's interesting.
And I actually found something.
And then...
Oh, you have it?
Yep.
Yeah.
The
and that's kind of curious is why.
Yeah, why we have it.
So here...
Well, yeah, I want to know, because is the truth because she's just not getting paid for it? Or?
She tried many things.
Well, she also had eczema too, so
maybe
they could have probably been trying to do stuff for that.
Yeah. So it looks like that's what it is, right? She would not do it again. Regrets it. Was not able to use a numbing.
Yeah. See, that's what.
Wow.
So that makes sense.
Painful.
It is painful. That's why
painful.
you need numbing cream for that. Absolutely.
Okay.
So it's not that she doesn't want to do it again.
But
She's
the microneedle?
traumatized from it.
Yeah.
So is the micro needling say you're not doing the blood part of it, because micro needling is.
I can do micro needling all on its own. You still need numbing.
You still need numbing.
Absolutely.
For that. Okay.
Yes, that is traumatizing because just imagine if you've ever had a tattoo too. Some people think of that when they had a tattoo and they're like, oh. I know you get that rush from getting a tattue, but when you're thinking about your face, you're like, no, I don't want to do that again.
No.
Yeah.
That's traumatizing.
So you were talking about the blood. When I was thinking it was blood on the face.
Yes.
Probably because I'd seen that.
And I know I want to go back to what they said, what the reporter was saying. This is the hard thing about what I do in my industry. I have to do a lot of re-educating because they're like, well, you injected blood or I'm just placing blood over your face. And it's like, well, no, that's not what we're doing. And it is kind of injecting, but not in a sense of where I'm taking the needle full of plasma and injecting it in little spots around the face. I'm literally pouring it on and having the micro needle go through and create little micro channels in the skin to allow it to seep into the skin that way. So that's the kind of, it's hard to explain things to people because then some people get so stuck onto like, oh no, I heard and this is what they said and I trust them. I'm like, you don't even know them. You don't even know them. And man,
they're a celebrity.
Yes, they're a celebrity and this is what they got done. And
follow them on Instagram.
This is why, and it's always funny too, because like, oh, that's why Kim's face looks like that, because she gets vampire facials. That's not the reason why her face looks like that, but
what goes back to she's super freaking red.
And that's where you have to kind of tell people to get these realistic expectations. All this stuff takes treatments. It takes time. It took you years to get where you're at. It's gonna take some time to get to where you want to be.
It's constant maintenance.
Constant maintenance. We're always fighting that aging process. We're always fighting aging. That's the thing that sucks. Yes.
My nemesis, time.
It's like time. And that's why I say nothing's permanent, because we are fighting time. All we're trying to do is slow down time. What I tell people during my consultations is I'm going to slow down the clock. I can't stop it.
Yeah.
Unfortunately. If we could stop it, I would probably be out of business.
Yeah.
True.
All right, it's now time to put Nurse Whitney to the test. I'm gonna let her beautify my eyes. Great.
We need to do this every 3 months. You could.
Okay, that wasn't as scary as I thought. It was a little bit painful, I suppose, a little bit weird, but it's all worth it if I look young, right? All right, it's that time for our Bubbly and Beauty Secrets. We are popping bottles.
Ooh, did that.
And we're going to look at some really, really sexy lips in Hollywood and see who has maybe had some lips done or who's got natural lips like mine.
All right, first up, you could probably take a guess. The sexiest lips in Hollywood.
Don't drink too much. You're about
thank
to
you.
infect my face.
I'll try not
Miss
to.
Angelina Jolie.
Okay.
I would love to say no on this one because her lips have always
Her
looked
lips have
amazing.
always
Always,
look like that.
always.
Yes.
All right.
Yeah.
Well, that being said, could she have had them like volume?
She could have.
To maintain.
She could have
Maintenance.
had some maintenance done. This, though, I would say is probably not a most recent photo of her.
No, she looks very young.
Because this
So-
was a younger photo, and I mean, Angelina was always known for her lips. Everyone wants Angelina lips.
She's gorgeous.
I love her. And so the doctor, this is coming off Today Show, today.com or whatever, and the doctor on that show says, Angelina has the most famous lips in the world, the envy of women. For years, her lips appear totally natural and unaltered by plastic surgery. Older photos of her show the same plump, gorgeous lips that she has today, even though losing a bunch of weight a few years ago didn't make her lips smaller.
Wow.
Yes. Which, with that little excerpt on the bottom there, that she lost weight, she most likely lost volume and got volume replaced back into it. So
Okay.
making it look natural, like keep my lips the way my
They
lips
were,
have known.
yeah.
And you don't mess up Angelina's lips.
No.
Well, she can afford to like go to someone that's not going to mess
That's
up
gonna
her
know
lips. She's not going to the mall to get her lips.
Absolutely, yeah.
All right.
Mall doctor would be
And
so scared.
we're drinking
Oh, yes.
Yeah.
Banshee.
Banshee
I can't read the rest because I don't have
champagne.
my glasses on.
Banshee,
Yes,
10
Banshee.
of cups.
Yes, so Banshee Wines was born in 2009.
Ooh, it's a baby.
They are from Dogpatch neighborhood of San Francisco, Healdsburg, in the heart of Sonoma County. And I think that's that's where all the
Wine
vineyards
country,
are at, right?
yeah.
Wine country, so it's fitting.
It's really nice, actually.
Yeah, it is very nice. And if you have a champagne company or a wine company
Shameless.
or a
Shameless.
liquor company,
I think
send
this
us
should
something.
definitely be done in Temecula then.
Yeah.
And wine country.
Reach
Yes.
out. Would love to drink your champagne right now. Anyways, got it. Shameless plug. All right.
All right. So Scarlett Johansson. Beautiful.
Gorgeous
Scarlett.
lips.
Beautiful.
She's always-
Scarlett.
Yeah.
She's always had those lips though too, so I say that's natural.
Scarlett Johansson. Oh, I was confusing her with I don't know, another blonde in Hollywood, I guess.
God.
Well, Scarlett Johansson
all look
had
the
a few
same.
different hair colors. Like right here, she's
Yeah, she's brunette. Yeah. No, I was thinking Margot.
Wanna read it?
Maybe.
Oh, sure. Scarlett Johansson's lips have surpassed Angelina Jolie's as being the most kissable and requested in Hollywood.
That's interesting.
They
requested.
are requested. They're naturally full, sensual, and help make her a classic bombshell. A lot of patients ask me to make their lips look like Scarlett's, but it's impossible for a plastic surgeon to create perfection like
Yes,
this.
absolutely.
So if I came to you and said, make me look like Scarlett, you would say,
That's Scarlett. That's not you. So we're
And
gonna
I
find
would
your own kind
say-
of beautiful. Okay.
good answer.
is-
Good answer.
Yeah, I
Yes.
like that too because I think sometimes, especially I see a lot of people trying to look like Kim K. Like there are
yeah.
so many Kim K clones. Like
There's
Yeah.
so many.
Everybody
of them.
looks like her
and
these
it's like
days.
no, you need to look like yourself, but better.
yeah,
Yeah.
I like
you
But
need to
that.
look
accentuate your own
yourself, but
beauty.
better.
Yeah.
You're beautiful. If you were on TV, someone would be like, "I want to look like her."
Exactly.
Yeah.
That's just
I like
how
that.
it is.
Be yourself, people.
Just better.
Just better. Yeah.
Be better. Miss Beyonce.
Love her.
Natural lips.
No
yeah.
way. There's no way
There's-
she's not natural. They
She's
gotta be
natural. The beehive is gonna get you.
Yeah, there's no way she could have
She's natural. We love her.
Yes.
right? They've got to be natural lips.
Those
Oh,
are
you
natural
think?
lips.
I don't
Yeah.
think she's had anything done.
No,
feel
I mean
like.
maybe some
What?
Botox
I mean,
or
she's
something.
had
like
that
she's
stuff
got-
done so far. Like I
don't
said,
know.
she's been
I mean,
aging
but
very nicely.
She has. She has been. Well, I mean, I don't know.
I wanna
She's a
look like Beyonce.
Good
We all wanna look
gazillionaire.
like
Yeah, she is.
Trillionaire. Who knows? But I mean,
But what do the experts say?
You want to go?
Beyonce is the total package. All the single ladies would love to have her lips. While I speculate she's had a breast augmentation and a nose job. How dare you, doctor? Her lips look amazingly real. No need for needles or Restylane.
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 I love
Restylane.
Restylane.
If she
Resty.
came into my office requesting a lip enhancement, I would turn her
Yep,
down.
absolutely.
No
like
use
you.
messing with
Aw.
perfection.
Just like
you.
Oh my God, me and Beyonce are the same.
Cute. She's
I
very
knew
pretty.
it.
Yes.
You
You
knew.
wouldn't
I
want to touch
love
perfection. You don't want to touch perfection.
Well, so far all these people are perfect.
Yeah, everybody's perfect in Hollywood.
And Zila. I mean,
Well, let's
set
just
her
start
up.
by saying that's not a flattering picture.
That's not a flattering picture. She's had many better pictures than that.
Yeah.
Poor old Laura.
Aw, Lindsay.
That's kind of hard. I think she has had some sort of lip
feel like she has
enhancement.
too.
I don't
She
know about in this
definitely
photo
has.
right here.
And I've
but
seen some. I feel like I've seen like
recently.
bad
Yes,
pictures of her
absolutely.
lips.
Yeah.
Absolutely.
You know, she has that new Christmas movie out, which
Yeah, I
is
love.
awesome. I
liked
loved
it.
her. And I actually really love her. I think she's a
I do
fantastic
too.
actress.
I do
Yes.
like her.
But even her lips in that movie, I was like, oh, girl,
Yes,
far.
too much.
Too
It was too
far.
much.
it was a lot.
Actually, talking about the cheek structure on her face, I was like, "There's filler there too, and we need to go through and dissolve."
Do you just do that? You just do that, don't you? When you watch shows and movies,
Oh,
you're just
I
like, she
can't
got
help
that
it
done? You just got that
anymore.
done?
You get
I
to see
can't
it.
help. I'm just like, oh, why did they do? Who did that? Who put their name on that?
How do you,
like
so
a
the
signature.
dissolve,
Yeah.
it's like a
So there's a agent that you can place in. So if you get fillers, for instance, say you don't like it, you can have it dissolved. So mainly what we're using dissolving agents for, it's actually a safety thing for us to have the dissolving agent because our face is so vascular. That's why we talk about bruising all the time. Like there's no way I can't make you bruise. If you don't bruise, I'm surprised if you don't bruise.
Right.
But makeup covers bruising. I tell everybody it's definitely dark lip season too. So if you're gonna have lip filler done, it's the perfect time because you're gonna just put some dark lips on it. But we use the dissolver. It's called hyaluronidase. Hylenex is the name brand for it that we use here, and you just place it in and it dissolves all of the filler that's in the lips.
Where did, like, you poop it out, pee it out?
No, it's an enzyme and it actually just eats it away in a sense, and your lymphatic system gets rid of it.
Wow.
How long does it take to dissolve?
You pretty much see it instantly.
Really?
Yeah, you're a little
That
swollen.
would freak me out a little
That'll
bit.
look cool.
Be like,
It does. We will see like the filler just like I said water.
and
It
so
turns
does it come
deflate.
out
to
of-
us. It feels like a little watery substance.
Oh,
No, it
that's
stays
not-
in your
Wow.
body.
Oh,
No.
it stays in
so
the body.
it's in your
Okay.
body, and then your body will naturally get rid of it because now it's
Wow.
broken down to its most simplest form to your
fascinating.
body
It's good
to
to
take it
know.
out.
Yeah. So if you get fillers and you don't like it, it's not the end of the world.
Yeah.
Yes.
Dissolve it.
So
Dissolve
how much does
Tell
it cost
Lindsay.
to get it dissolved if you don't like it? Because that's like
That varies.
It varies.
That varies.
Yeah.
Starts out like 150.
It's not so
It
bad.
goes up from there depending on how
You have
many
to pay
vials
for
are
a
necessary.
mistake?
yeah.
Not okay. So
Oh, okay.
actually,
Okay.
hold on. Red flag
She
there
got,
too.
she got the finger
Red
out.
flag. Some providers actually do charge for that, but honestly, a good provider will not charge to fix their mistakes. If it's their mistake, they should be fixing that.
True.
And so that's actually, I kind of want to go into a little segue here and talk about importance of lip filler. It's actually a really important procedure to know that your provider understands this. There's a risk of vascular occlusion. That's why we have the hyaluronidase. That's mainly what we use it for, and we keep it for. Even though it's a rare occurrence, you want to make sure that they know this, because if you have a vascular occlusion, meaning there's no blood supply going into that lip tissue can die. And you don't want that to happen.
No.
So I always tell people to go on the side of caution, ask them these things when you go in to get consultations. Do you understand what hyaluronidase is? Do you know what Hylenex is? Or do you have the
Sounds like
dissolving
hollandaise
age?
sauce.
Yes. Can you dissolve my lips if I don't like it? And they'll typically tell you like yes. And you should be able to ask for those things and see it.
Will they be able to know if you have a clue, whatever you just said? Like
Yes, so
okay.
there will be like severe pain in the area.
Okay.
You will see discoloration that's
Okay.
outside of bruising.
And you're saying that's caused from the filler? Or
That's from the filler,
like
yes.
It can be caused
so
from the
this
filler.
is like your vein. I'm placing filler in right here, and your body's going to swell. So, and it's not used to having that volume right now.
Right.
So that swelling causes that. Like I said, if you're going to someone who's knowledgeable, that shouldn't be a concern or a risk, but something to
So we
watch
should
out
tell
for.
Lindsay. Lindsay, get it
Yeah,
dissolved.
so Lindsay, dissolve your
Get it
lips.
dissolved.
Holidays.
Right here. So
Hollandaise. So
Hollandaise.
during one of her recent court hearings, Lindsay's
looks cute
lips
here, though.
looked like 2 bed-length pillows.
they do. And
They
you
don't
don't
were
want your lips to
unnatural
look like
plump.
that.
I like her
Unnaturally
lips
plump.
here, though.
You do?
I do. I think they look
That
pouty.
looks really fake, though.
That looks fake.
It
That
looks like
fake.
it's a bit like
Hot
you know,
dog-ish.
Yeah.
You don't
It does
want-
look like it's like swollen.
You can see that there's lip
Well, she
filler
got,
that's
like-
in the mustache area.
I think she
actually.
needs what you're going to give me
Mascara.
under the eye.
Is
Oh,
that her court
Lindsay.
hearing? Oh, she must have been crying.
She was so beautiful when she was
When was
under-
she last in court?
I don't know. I don't know.
She always in court.
I don't know.
Yesterday.
Oh, God.
No,
Oh,
I am
Megan
a-
Fox.
Megan's had her lips done.
She's definitely had her lips
Yeah.
done.
I
But they're
mean,
beautiful.
She is just
They're
lips are
beautiful,
beautiful.
and they're
So
drinking each other's
sexy.
blood.
They are?
Yeah.
Her and Travis.
What do you mean?
What?
They drink each other. They drink each other's blood.
You
She
mean
said.
in GK?
Yeah. Oh, I said Travis.
Yep.
Okay.
What do you
wrong-
mean they
wrong
drink each
rocker.
other's blood?
They drink each other's.
That's
She said it in the
weird.
thing. They are soulmates. They drink each other's blood.
Oh.
It happened. I don't have.
Isn't he abusive too? Anyways, we're
I don't know.
getting off-
Good enough subject.
Go ahead.
Okay,
We're talking about Megan's
so,
lips.
Megan Fox is this generation's Angelina Jolie, just without the Oscar. Oh, and the naturally full lips. Burn. This first sentence is so loaded.
That doctor is
I think we
It's like
got
a
it.
really mean first sentence. While you can't buy an Oscar, and it gets worse, you can buy full lips, which is exactly what Megan appears to have done. It looks to me that she has transformed her
looks
lips
good to me, though.
into quite possibly the sexiest in Hollywood. No one shows off her pouty lips like Megan. Bravo to her plastic surgeon.
I would agree. I think
they look
bravo.
good.
I think she looks incredible.
She looks amazing.
Absolutely.
Yeah.
But can we say, I just have to say, everybody always thinks someone's got something done. And like, maybe it's possible someone is just naturally blessed.
They are.
Yeah, some people are.
Yeah, not in this town, but
Or maybe they were. Maybe, you know what I think happens a lot too? Like, people are like really naturally beautiful, and then in a town like this,
you
you get
create
sucked into it, and then
Yeah.
you end up looking.
It's a type of body dysmorphia. Yeah.
Yeah.
You start looking at yourself and not
you're
liking
like,
what you see
"Oh,
anymore.
Yeah. Well, hey, what do you
I'm
do?
not. I'm not going to admit to that.
We all have it. It's okay.
She's gorgeous.
We all have something we would like to
absolutely
fix.
Yeah.
So Whitney, where can people find you? What are your specialties? What do you think people should go to you for?
Oh, that's a loaded question too. Well, you can find me in Marietta, California.
Are you on Instagram?
On Instagram at Injector Nurse Wit or at Pure Glow Wellness. Injector Nurse Wit is where you'll see all my work that I've done over the years. And you can make an appointment anytime. I do IVs, PRF, like I said, dealing with natural rejuvenation, all of the fillers, all of the Botox that you want.
All right, guys, that's it. Thank you for tuning in to another episode of the Champagne Hour. Make sure you like, comment, and subscribe, and we'll see you next time.
All right.
Cheers, guys.
Cheers.
Bye.
Bye. I like saying bye like that. Bye.